So we're going to be talking about lips today, about augmenting or making lips larger. But it's not always about larger. Very often it's about proportion. When we look at a woman's face, we want to look at the size of the eyes, we want to look at the size of the cheeks and the size of the chin. And the lips need to be proportional to those other attributes. When someone has big, beautiful eyes like this and big cheeks, they can carry a bigger lip. And then we need to look at the proportion between the top lip and the bottom lip. And very often a woman will see their top lip as being smaller than it really is. And you say, well, why is that? Well, number one, when a person looks at their own lip, they're looking downward, typically in a mirror. So the top lip looks smaller. Here's a picture we took before treatment, and it shows on the left how someone would view their own lip. And it looks like the top lip is smaller than the bottom. This is in reality where the bottom lip is actually smaller than the top. So if this person came in and asked for their top lip to be larger, it actually would become too large and not look proper. So our goal today is going to be to make the bottom lip a little bit larger, where the proportion between top and bottom would be about 2 to 3 or 40% to 60%. And that's typical in a Caucasian face. Other races, cultures, that proportion may be different. An African American lip is typically 50-50 as an example. So if we made this patient's lips 50-50, it wouldn't look right. So it has to be specific to the other attributes of the face and to culture. The other thing we can do is use tools to actually measure. Sure, we do it with our eye after a couple of decades, but it's actually based on measurements that are set by the distance between the eye, and that sets what the width of the lip should be. It actually determines where the arch of the brow should be, the width of the chin, and other parts of the face. What we do today is inject, and instead of using a needle to do the injection, we're going to use what's called a cannula, which is a blunt tube that is much less traumatic. It hurts less, it creates less swelling, less bruising. Once patients are injected with a cannula, they'll rarely ever let you go back and use a needle. What we're going to do first is create 2 tiny little entry points in either side of the lip, and that is going to be where we thread that tiny blunt little tube called a cannula through to inject the lip. Our goal is to invert or to turn out the lip to make the lip fuller and a little bit wider. But a youthful lip is pouty. We never want to make this bottom lip extend all the way out to the side. That distorts the lip. We want a lip to be youthful and pouty. So we are creating an entry point, lower lip, 1 injection. And through these 2 little entry points, we are going to do the injection. And these 2 little entry points will heal very rapidly. So this is a blunt cannula. This has no point at the top. It's nice and blunt. So we are now injecting. How we feel?
Great.
No pain?
Mm-mm.
Good. So we don't want the filler to go all the way across the lip. We want the bottom lip to have a couple of what we call little pillows, where there's prominence over here and prominence over here. And one of the other things, if you zoom in, you'll see that very often the dry part of the lip, the exterior part of the lip, gets very wrinkly, and that's just from exposure to the environment, to sun and to the wind. So using a topical moisturizer or a high-intensive hyaluronic acid will actually make this skin smoother and complement what we're doing with the filler. So we just injected the lower lip and we corrected the proportion between the top to the bottom now to 2 to 3. There's a little bit of swelling in the lip, so this bottom lip is going to look better in about a span of an hour. It's not going to take very long because we didn't use any needle inside the lip. We used that blunt instrument called the cannula. And so the lip will look better about an hour. I don't expect any downtime whatsoever. I don't expect any bruising, and really not much swelling at all. And we then put a topical solution called HA5, which is an intensive hyaluronic acid solution. And what that does is hydrate the lip. Because not only do we want the lip proportion to be better, but we also want the texture to be better. See how the lip looks smoother? That's from the filler, which absorbs some water, also from the topical called HA5. Smile for me? Good.
So how did you think it went?
I thought it went very well. Everything was very easy. There was no pain, and I love my results. I was worried that it was going to hurt, and I had no pain.
Were you worried about your results not being what you imagined or being overfilled in any way?
No, because Dr. Chasin spent a lot of time with me and we discussed everything, and we both agreed on the same look.